Folk Illnesses in Latin Culture by Jessica Hatch and Avery Sawyer. It's important for healthcare providers, especially those serving Latino populations, to understand folk illnesses because Latino patients who adhere to traditional beliefs about illness may be influenced by these perceptions in ways that could affect their treatment or their compliance with treatment. It's also crucial that healthcare providers respect their patients' beliefs regarding their own health and how to manage it. Ataque, or Ataque de Nervios. This translates as attack or attack of the nerves, and it's an acute expression of anxiety, shock, or sadness. Although it's very similar to a panic attack, it is its own distinct syndrome with a specific pattern of symptoms. These symptoms can range from uncontrollable screaming to dissociative experiences. This syndrome is most commonly associated with Caribbean cultures, but can be found everywhere in the Iberian Peninsula. Empacho, or estreñimiento. Empacho translates as indigestion. Estreñimiento translates as constipation. This is believed to be the result of an obstruction, which is due to poor dietary practices such as overeating, not chewing food thoroughly, consuming spoiled food, eating at the wrong time of day, or combining the wrong foods. One important thing to know about empacho is that although treatments are usually harmless and involve dietary restrictions or drinking herbal teas or abdominal massage with warm oil, there are documented cases of lead poisoning in children who have been treated with powdered folk remedies known as Greta or Azarcon. These contain lead and can be dangerous. Mal aires, or mal de aire. This translates literally as bad air. It's associated with both stuffy and poorly ventilated or polluted air, and also with cold drafts, such as those caused by an open window. Some traditional Latinos believe that open windows can cause colds, headaches, or even tuberculosis. Treatment for this usually involves a practice called cupping, where cups are squeezed and pressed into the skin, creating a vacuum beneath and suctioning the skin. Mal de ojo, or mal ojo, translates as evil eye. This primarily affects children. It occurs when someone, without necessarily having any ill intent, admires or covets a child without touching them. It's important to note that this effects of evil eye can be counteracted if the admirer touches the child. But it's believed that the gaze of the admirer heats the child's blood and causes fever and inconsolable crying. Sometimes to prevent mal de ojo, parents will put amulets on their child, either bracelets or necklaces, or they will pin them inside their clothes to ward off the evil eye. If you get the evil eye, then treatment is performed by a curandero, and the curandero performs a sweeping ritual which cleanses the child. Susto, or asustado, translates as scare or scared, and it's a condition caused by a traumatic experience, such as a bad accident or witnessing a death of a family member or someone close, and this experience temporarily scares the soul out of the body. Without the soul in the body is weakened, and the immune system is weakened, and it's more susceptible to disease. Diabetes is one disease that is thought to be facilitated by the presence of susto in an individual. caída de mollera, or mollera caída. This translates as fallen crown or sunken fontanelle. This typically only affects children and small babies, and it's believed to be caused by removing the nipple or a bottle from the baby's mouth too quickly. It can also be caused by dropping the baby or carrying the baby incorrectly. You will know if the baby has caída de mollera because they'll have issues with feeding effectively, and the symptoms are associated with poor nutrition. Treatments can range from applying a poultice or compress of herbs to the roof of the mouth, to holding the baby upside down over a pan of water while slapping the bottoms of their feet. Go.
Traditional medicine in Latin culture. Traditional folk healing. Religious beliefs and spirituality play important roles in the health of Hispanic Americans. It is often believed by Hispanic Americans that health problems is a result of God's will. Many Hispanic Americans do not have access to health care and become what is known as traditional healers who use herbal remedies to treat their condition. In the picture on the right, you see what is known as one of the traditional healers praying with the patient. Healthcare beliefs in Latin America. Curanderismo in Mexico and Latin America distinguish between hot and cold illness and occasionally between natural and unnatural diseases. They bring the psychic and spiritual gift to those requesting healing and cleansing. Brujos and brujas, are also known as wizards and witches, are used for treatment of bladder conditions such as cancer or a condition that's chronic or progressive. Herberas, or herbalists, are highly knowledgeable of the use and remedy of various plants and herbs for treatment needs. Huesueros, also known as bone setters, are similar to chiropractors, and they aim to realign and set bones by using herbs or potions like the herbalists use. Parteras are midwives, and they help pregnant Latin American women deal with the delivery, guidance, and care of a newborn baby. A sobador is similar to a massage therapist, and they're trained in healing practice that uses rub and massage technique. Culture barriers in healthcare include language, lack of insurance, different cultural beliefs, illegal immigration status, mistrust, illiteracy, education, socioeconomic status, and degree of acculturation. It was also said in something that I read online that a lot of Latin Americans that come to America, they feel uncomfortable with American healthcare, so that's why a lot of them choose to not seek healthcare in America. Curanderos, also known as healers, use herbs, aromas, and rituals to treat the illness of the body, mind, and spirit. Ceremonial approaches are often used by curanderos to heal. For some chronic conditions, herbal remedies and rituals may be insufficient and cause risk for the patient. An example of an illness that herbal remedies may not cure is diabetes, due to the body's need for insulin to survive. In the picture on the right, you see a curandero on the street helping a patient. Higo Chumbo Remedio is known as the prickly pear remedy. The prickly pear is a cactus that's grown in Mexico, the Mediterranean, southwestern U.S., and various parts of South America. It's high in vitamin C and it's rich in antioxidants. And the flat stems or the pads of the cactus are called nopales or nopalitos. The cactus produces small round fruit known as prickly pear fruit. Both parts of the plants are commonly consumed as a remedy, and a lot of people eat it. It is used to treat type 2 diabetes, elevated cholesterol, obesity, colitis, benign prostate hypertrophy, arteriosclerosis, and it can also help with treating hangovers following excessive alcohol consumption, and that's because it's so rich in antioxidants. The risks include diarrhea, nausea, increased feces, a sense of satiety, and headache. Aloe vera is a plant with various healing benefits for conditions that include ulcerative colitis. It can work as a laxative. It soothes pain associated with osteoarthritis and bursitis. It helps with diabetes, asthma, epilepsy, and soothing for burned or irritated skin due to sun or cold exposure. And if you look at the picture on the right, you can see that the plant's broken, and you can see like the bead with the juice on it, and the juice is what a lot of people put on their sunburn. And studies also suggest that the gel can lower blood glucose levels and amplify the action of medications for the treatment of diabetes. So it could produce hypoglycemia, which is a drastic drop in blood sugar. It is estimated that in many Latin American countries, a great part of the population heavily depends on natural medicine to cover its primary health needs. And when they immigrate to the U.S., they hold on to these traditions for historic and cultural reasons, in spite of having advanced, fast-acting, and effective medications at their disposal. Menta remedio, also known as mint, is used in medical compounds and as a flavoring agent. This remedy is used to treat a common cold, inflammatory conditions of the mouth and the pharynx, sinusitis, liver, gallbladder, and intestinal ailments, nausea, vomiting, and diarrhea, menstrual cramps, and flatulence. Peppermint and wild mint are often used in tea to treat colds and flu. As a warm tea, it combines well with other digestive herbs of a similar character. It combines well with other blood-cleansing herbs to cleanse the blood of excess toxins. The action of the mint is that it will open the pores and guide the medicinal effects of the other ingredients toward the skin. Its soothing, aromatic properties can also guide the effects of an herbal formula towards the throat, head, and sinuses. And our last page includes the references that we use throughout the presentation.